The first group of recommendation is very popular also among us. Just think of how much time you dedicate to sufficient sleep and relax. But we should say that for normally functional immune system, it's very important to have sufficient relax and to have sufficient duration of the sleep. Of course, exclusion of passive smoking. Besides the prevention of respiratory tract infections, this is also important preventive factor against the development of allergic diseases. This is one of the possibly useful recommendations for decreasing the development of allergies. Of course, it's very important to maintain sufficient convalescence after the infections, not to put the child directly into collective after 3 days with infections, because you know that the viruses are damaging the respiratory epithelium, and it's very, very risky that the child will get another infections in this susceptible area. And then we have the vaccination. I'm strongly pro-vaccination doctor. I'm doing also the vaccination of risk population and of risk childhood. And I will be focusing on the possible way of immune support, which is named immunomodulation. As you know, we stopped to use the term immunostimulation because we do not have any strong immunostimulants. We have only the possible therapeutical intervention into immune system functions, which can be used for modulation and for modification of changed immune reactivity. So immunomodulation can be used both therapeutically, also preventively. And by this approach, we can even normalize the immune functions. We can support the dose which are decreased. And of course, it's very important that immunomodulation can also modulate the inflammation and prevent its consequences. Taking into account these three facts, we can use immunomodulation, of course, in recurrent infections. This is the most common indication, but also in secondary immunodeficiencies, which are very, very common in daily practice. But today we know that immunomodulation can be an important strategy for allergic patients because they are suffering from very high number of infections. And today we also know that the dogma that autoimmunity is contraindication for immunomodulation is not valid anymore. And in a very personalized approach, you can use immunomodulation also in this patient. Because you know that, for example, the child with juvenile idiopathic arthritis, which is treated by methotrexate, is usually suffering with high number of the infections. And we should help the child to decrease the infectious rate. So just to summarize, we know that immunomodulation is an important part of prevention and treatment of respiratory tract infections. And in the first line, we should use especially natural immunomodulators. We can sometimes use also the combination of different products just to support the mechanisms of action of each other. And what is important, we should have very high purity and concentration of active substances, and we should clearly know how the particular immunomodulator is working in our immune system.